Hey there, this is Dr. Quirk with a recent shoulder trauma case that we had. So here are the two radiographs we have. These are just two views, and the text note said that the patient was unable to move their arm from this position. So I'll give you just a few seconds here to look at this. All right, so what I want you to notice here, here's our axillary view, and here we have what's supposed to be an AP view, and the patient's arm is stuck in abduction, and you can see here that the humeral head is not normally aligned with the glenoid, which is kind of hard to see on these images, but that's the best that they could get at the time. So this is actually a pretty rare case of a shoulder dislocation that's also called luxatio erecta. So basically, you specifically have a inferior dislocation of the humeral head, and the humeral head gets trapped under the glenoid, or it can get trapped under the coracoid. And so they're externally rotated and abducted, abducted. The thing to know about this one, other than that, it's pretty rare, and about 0.5% of shoulder dislocations. There's also neurovascular injury that can occur with the axillary vessels there. Brachial plexus are going to be running along that kind of anterior inferior border of the glenohumeral joint, and so the humeral head can damage those as they go through that region. And then, like we said, they present in this fixed abducted position. A little bit more about shoulder dislocation. So the anterior dislocation is going to be the most common by far. 95% of cases are anterior. These patients come in with this radiograph where the humeral head looks kind of anterior and inferiorly dislocated. The best way to tell that from luxatio erecta is obviously that they're not abducted in this position. It usually results from an anteriorly directed force on the arm while in abduction or external rotation. There are some known associated injuries that you need to look for, such as the Hill-Sachs impaction fracture along the humeral head, which will be in this region, and then the bony Bankart lesion, which is going to be in this area. And then once they get the MRI, you look for the soft tissue Bankart variants, such as like a Perthes or a true soft tissue Bankart. And then the other thing to know, in younger patients, there's a very high recurrence rate, up to 90% in patients who have their first dislocation before the age of 20. This has to do with just having instability of the shoulder, which we can talk about in another PowerPoint. Posterior, much less common, but they're much more easily missed. They account for 2 to 5% of dislocations. You get similar types of injuries, but they're the opposite of what you see with an anterior dislocation. So you get a reverse Hill-Sachs or a reverse Bankart lesion. The other thing you can look for on a radiograph is called a trough sign, which is a representation of the reverse Hill-Sachs. So you have your impaction fracture here along the anterior humeral head in that situation. These patients also tend to have, they kind of come in two forms. They can have a severe trauma. The classic history is seizure. The other thing that you may see is they'll have a posterior glenoid hypoplasia, where their posterior glenoid isn't normally formed. This isn't the best axillary view to look for that, but you can see it sometimes on an axillary view or on the MRI or CT, where the glenoid is kind of posteriorly sloping. It's similar to developmental dysplasia of the hip, in my mind anyway, where there's not enough bone back here, and then the labrum or cartilage will try to hypertrophy and kind of produce some stability posteriorly, but it doesn't work that well. These patients on their radiographs will look like they're stuck in internal rotation. So if you have an internal and external rotation view and they both look like internal, you should consider it. You can tell them to get an axillary view where you can pretty easily see it here. You can also tell them to get a scapular Y view, though that can be a little bit hard too. And then the last form of shoulder dislocation is actually something called an intrathoracic dislocation. Super rare. There's only like maybe 20 to 50 cases ever reported. But this is usually a high energy trauma like a car accident, motorcycle. But you can see in this case, had a proximal humerus fracture. There's a bony opacity within the left hemithorax here. Had a CT done, and here's their humeral head sitting inside the chest. This patient actually survived, and they were able to get that out of their chest, and they just gave them a total shoulder arthroplasty. Thanks. Always email me if you have any questions about any of this.